this video, I'll be showing how to do trach suction, trach safety check, changing the inner cannula, and changing the trach dressing. So the first thing that I'll do is check my patient's chart and physician's order for the humidification order and the patient's trach size, and then I'll do hand hygiene and enter the patient's room, introduce myself, explain the procedure to the patient, make sure I have the right patient, and then I want to make sure that I'm wearing gloves, mask, eye shield to protect myself from any secretions. And then I will make sure that the patient is in semi-Fowler's position, which he is. And then now we're going to do the trach safety check. So we'll just move here. So first thing that I'll do is check the suction equipment, make sure all of the tubings are connected, and check the suction pressure, make sure that it's set within 80 to 120 millimeters of mercury. So to do that, we'll check the tubings, and then
Make sure that my patient has the oxygen flow.
we can turn on the suction. And to check the active suctioning, we want to place our thumb on the suction end and then check the gauge. Right now it's at about 115, so that's good. And then we can turn off the suction for now since we won't be using it yet. And then next in my safety check is checking the oxygen equipment. Again, making sure that the tubing is connected. And then I'm following the tubing to my patient. And then checking the oxygen. And the humidification. So doctor's order is to set the humidification to 45, which I will need 10 liters of oxygen per minute. So then this is where we would check the humidification. And then our oxygen would be set at 10 liters. And then we'll turn it off for now so that you can hear me. Next thing that I'll check is make sure that I have emergency supplies at the bedside. So things that I'm checking for are extra tracheostomy tube at the correct size. So our patient's trach tube is 7 cuff. And then we're making sure we have extra disposable inner cannula in the correct size. Suction catheter at the correct size. Extra drain sponge. Extra trach ties. And we want to make sure that we have an ambu bag in case of emergency, and also a dilator. And then we can also check the pressure of the cuff using this manometer. And then we also want to make sure that we have sterile water at the bedside. And then now we will move on to the trach suctioning. So we want to make sure that we put on the O2 sat monitor onto our patient's finger, and then we want to make sure that we are monitoring our patient's O2 sat and pulse all throughout the procedure. And then we want to make sure that we have the correct size of suction catheter. So to do that, we can look at our patient's trach size, which can be found here. So it's size 7. And then we can use the formula -2 times 2. So 7 minus 2 is 5. And then times 2 is 10. So our suction catheter, we will need 10 French, which we have here. And then before we do suctioning, we want to pre-oxygenize our patient. So our patient is conscious. So we would want to ask our patient to take 2 to 3 deep breaths. And then we want to check their O2 sat, make sure it's at the 100%. And also we want to make sure when we the oxygen is set as high as possible while we're asking them to take 2 to 3 deep breaths. And then, of course, I'll do hand hygiene. And Like I said, I'll be wearing gloves.
And also now that I have suctioned my patient, the air is clear now.
So then we'll use the suction and apply we'll put on the suction catheter. We'll connect that onto the suction.
Removing the old inner cannula here. So I will.
And then we want to have the suction on. And then again, check the suction pressure. So it's at 100 right now, so that's good. And then we already pre-oxygenated the patient. Now we would take off the trach mask, and then we want to keep 5 inches of the suction catheter sterile. So that's the part that we're inserting into the patient's trach. And then while we're inserting, we don't want to apply suction yet.
We went to the way last weekend. Yeah, that was cool.
And then once that's in, while we're withdrawing, we want to apply intermittent suction and then twist the suction catheter while we're slowly withdrawing it for 10 to 15 seconds. And we don't want to exceed the 15 seconds. So apply intermittent suction while pulling slowly. And then we will dispose of this in the garbage. And then I will do hand hygiene, put on a new pair of gloves, and then I would also suction on sterile water so that we can make sure, so we can maintain the patency of the suction, make sure the suction is clean. And then turn it off for now and put the suction inside clean gloves to make sure that it remains clean. We'll just use this for the purposes of this video. And set that aside. And then now we're gonna move on to changing the disposable inner cannula. So I'll be using the no-touch sterile technique. So I'll move my dressing tray. I've already set up my dressing tray beforehand. So then we want to make sure we do hand hygiene, put on clean gloves, and then we want to open the disposable inner cannula packaging. Again, making sure we have the right size. This is size 7. We want to open that and set it aside. And then we want to stabilize the tray. And then remove the old disposable inner cannula, and we will dispose of this in the garbage. And then again, I'll do hand hygiene and put on a new pair of clean gloves. And then we want to touch or handle the new disposable inner cannula at the lip here. And we want to maintain the rest of the part of it sterile. And then
it was terrifying.
we want to
I've never had such a crazy response to
stabilize the trach and then insert it at an angle. And then we will remove the soil dressing. Again, I would dispose of this, change my gloves, remove my dirty gloves, do hand hygiene, and put on a set of clean gloves. And then we want to assess the stoma, the peristoma skin, for any redness, swelling, any signs of infection. And then we want to clean the stoma for the peristoma skin with cotton tip applicators dipped in normal saline. We want to start from cleanest to dirtiest, so starting from the skin that's closest to the trach. Oops, I just broke that. We want to, I'll dispose of it. So we want to do one swipe per wipe, and then do the top. And then I can even use 2x2 gauze to clean.
It's always carrying size, no matter who it's been. It's 30 liters, which is like about as like carry on size.
So I just got my sterile dressing tray wet. It's kind of large spill, so I can also, I would, in the real life setting, I would ask for help from a buddy nurse or another nurse and ask them to get me a new sterile dressing tray, but we're gonna continue for the purposes of this video. I'll just avoid that wet spot. And then you wanna,
I can also remove the trach ties.
That only makes sense.
So that the patient is not
I don't know yet. Yeah, so the girl that's doing it, she was in Winnipeg for a couple of years.
and then next we wanna make sure that the skin is dry before we put on the new trach sponge. So we can use a dry 2x2 gauze to dry the peristoma skin.
She does that, but like with flowers. Yeah. Like she has, I've seen these where she has it's like unique, but it also has on it. Yeah.
And then next is we want to apply the trach sponge. So we want to keep the center portion of the trach sponge sterile. Put that on. And then we can use our hand. We want to make sure that we're only touching the outer portion of the drain sponge. We want to keep the inside sterile or the center portion sterile.
Yes, yeah, it's still like really
yeah, we can use this.
like I have here and then everything is square.
So once we are finished with putting on the trach sponge, we'll do hand hygiene, and then we want to put back the trach mask. And then we want to restart the oxygen at at an ordered rate.
All good?
And yeah, that's pretty much it. We want to make sure that it's at the correct rate, which is at 10 liters per minute.
Yes, I did it right.